So this program has a long history, probably almost 30 years now, of training rural residents. Much of the success of southern Manitoba, in fact, is seen in the graduates of this program. So about 180 graduates so far, and almost 80% are working rurally still. So I find that we find that most of the residents who graduate from this program are ready and willing to work in almost any rural or northern environment, and comfortable to do so with clinic or ER or hospital work. So I think it's definitely fulfilling its mandate.
Growing up in Dauphin, knowing that the program here has been here long-standing, it's one of the longest running rural programs I think in Manitoba, and just having family in the area, it was always high on my rank list. And yeah, certainly I think knowing that there's good preceptors here, talking to people who graduated from the program, after they graduated, they felt that they were quite competent in multiple areas of family medicine, really drew me to the program. Yeah, I think it's the one nice thing about being in a rural stream is the fact that you get a broad scope of practice. You get to see you get to do your emergency medicine, you get to see your family medicine, you get to do some obstetrics, you get to do kind of a little bit of everything, surgical assist, you name it, we can kind of do it out here.
Dauphin program had all that I was kind of looking for in a program. There's lots of hands-on experience that the residents kind of talked about early on. And I think even within kind of doing my first 4 months of family medicine block time, I've already delivered a baby, I've stitched up people in the emergency department, I've done a punch biopsy, I've done a breast biopsy, I've done lots of hands-on experience and getting fully immersed in family medicine, that kind of womb-to-tomb kind of value of family medicine.
Program's been around for a long time, has a good reputation, and I felt confident that it'd be a good experience.
So far, it's been amazing. I'm in my second year. I think our program is pretty unique. I've had a whole bunch of one-on-one experience with my preceptors. There's no competition with any other learners as and I feel like it's pretty unique in a way that every preceptor has something extra to offer. So we have preceptors that have specialized in ultrasound or obstetrics or geriatrics, personal care home. And I see myself, I want a good blend of stuff so I don't get bored with just clinics. So I wanted to experience that, and I feel like Dauphin satisfies all of that. Everyone's been super kind. Everyone's been very helpful in terms of helping me just become a part of the community, as well as just in terms of the learning environment too.
The program was developed in Dauphin and has a number of advantages and strengths for our residents. We try to use a model here where you have one primary preceptor and you work more or less one-on-one.
It's a good program if you really want to learn and you want to advance and want to progress in a friendly environment.
I want to be a part of a program that encompasses training for a family physician to be a jack of all trades. So the program here lived up to that as I get to work in clinic, in the inpatient setting, in the emergency department, alongside, of course, training in the city as well. So I got to do a little bit of everything, which is what I was looking for.
My history with the program started back in Med 3 as an elective student. And I was out here working with Dr. Kish and a few other people. And I was really struck not only by the sense of community that existed among the practicing physicians, but also by the natural beauty of the surrounding area. The park just here in town, Vermilion Park, the prairie, the mountains just here in Riding Mountain.
I kind of knew the community a little bit and knew that it was a good community in a good area. Close to the park, so lots of outdoor things to do there. So that's another thing that played a factor in why I wanted to come here. And I think the program also just has a lot of different staff that have done residency here and then are now training further residents, which I think that's really helpful as well. This program also has access to surgeons, an obstetrician, So you're working with other specialists that maybe some of the other programs don't have as much.
It's been really nice over the years just to meet people and learn from them and watch how medicine's changed since I've been here in 2008. And we've had fun. We've gone cross-country skiing, we've gone jogging, we've gone walking. So although there's been a lot at work, we've also made really good friends as well.
It's a big enough program that you can create a bit of a sense of community with your fellow residents, but the community is open and welcoming too. And I think that also speaks to our success in turn, recruiting our graduates to end up staying here. I think there's lots of programs, certainly in the province, that you can consider, but I think there's a number of factors that set our program aside, and I think residents should consider coming here. I really do.